I'm Dayo Akondiagbola. I work at Simon Special Needs Center. We provide variety, therapeutic, and support service for kids with special needs. It is Autism Awareness Day. Do you have an idea of what autism is all about? Come with me.
My name is Hania Badmasiu Salisu, the proprietress of Simon Special Needs Care Center.
My name is Dayo Akondiagbola, a therapist at Simon Special Needs Center.
Simon Special Needs Care Center was officially opened on the 9th of January 2021. We care for children with special needs such as autism, Down syndrome, ADHD, cerebral palsy, and any other special needs.
Autism is a neurodevelopmental disorder that is characterized by limitation in communication and repetitive behavior pattern. It's a spectrum, yes, from the mild to the extreme condition. We have kids that are non-hyperactive and kids that are high hyperactive. Like I said, it's a neurodevelopmental disorder. It has to do with nerves. The way the brain of these kids are wired. They are wired differently. That's why I say it is neurodevelopmental disorder. There's a difference in how we care for a kid that is autistic and a kid that is neurotypical. Because autistic children, they are characterized by a repetitive behavior. There's a behavior that's different from a child that is non-autistic. So the way we care for them is different from the way we care for other kids that are non-autistic.
Autistic children has this short attention span. So in taking care of them, we always try to teach them this good behavior and how they can concentrate, give you an eye contact so that you'll be able to direct their behavior to a positive direction.
The challenges are numerous, but the one I will talk about is the area of where the parents are not complementing what we are doing to help the kid at the center. For example, a child that has a behavioral problem in the area of social skill that cannot initiate conversation or to mingle with other kids. After teaching the child at the center the steps to initiate conversation, to interact with other kids, at the end of the week, can give the parent the task to take their child out to where the other kids so that the child can mingle with other or initiate conversation. In the case where the parents are not doing this, then there will be a gap. We will not be able to achieve our goal, our target for that kid.
Every child, no special need child that is extremely challenging or that we cannot handle. Although there are some challenges we face with them, but we try our best to make sure we give this child, because every child we handle teaches us a new thing about themselves. A child with autism, we teach you a different way, while a child with Down syndrome brings their own challenges and they teach you, and we work towards that to help every child. At Simon Special Needs Care Center, we believe every child is unique in their own way and every child can learn. So we develop this individual educational program for every child, where we teach every child at their own space, and we use a real life resource in teaching those children so that they will be able to achieve what we have set out for them to achieve. Because the Simon Special Needs Care Center, we include is an inclusive education where we do therapy and a normal curriculum education for them. We use STEM, which is science, technology, engineering, and mathematics. This is our core curriculum at the center. Positive reinforcement, empathy, and understanding what the child needs at a particular time. We preach empathy because in Simon's Special Needs Care Center, we are all about nurturing the child with love and care. So we try to give these children positive reinforcement, empathy, understand what they need to, so that we'll be able to direct their behavior in a proper way.
Yes, I will speak on that. Positive reinforcement is key. Yeah, that's the way we can encourage the kids to be able to give us positive behavior. So, example of what we use in positive reinforcement, we use a reinforcer. Look for a kid. A kid may be attached to a special toy that he likes. So before you give the kid that toy, you tell the kid to behave in a certain way or to do a certain task. If the kid is able to achieve that goal, then you give the kid the toy, then the kid will be motivated, will be happy to give out this behavior.
In taking care of special needs children, is all about collaboration. It's very important to involve the parents in the child's education. So we have everyday communication book where we send the home with the children so that their caregiver or their parents can go through what the child has done of the day. Then we have a progressive weekly report where we send to their parent, this is everything we've done during the week, this is the therapy we want you to go ahead and do with your child during the weekend, and everything, so that we'll be able to achieve our goals. No, any student is extremely challenging. They have their own way of approaching things, and we try to understand their needs and work with their strengths. So I don't really say any child is challenging.
So in that area, in the special need, like I said, we have non-apparative and apparative. Though I will say, like you said, there are no challenges, because every child is unique. All you have to do is able to discover the strength of that particular child and be able to know how you can apply whatever intervention that you want to put in place to be able to train the child to go in a certain way. Because every child has a potential. So it's for you as a caregiver, as a therapist, you need to tap into that. You need to guide the child in the right way to.
Yes, we always advise inclusion at home, in the community, in the working place, in schools, because we should always teach others what is special, what's the meaning of any special child you are taking care of, what they need. They should be able to understand the condition of this particular child. We should always accept them. We should not stigmatize them. Some schools, they will tell you they are practicing inclusion, but when you take a special need to that child, they will call you back to that school. They will call you back that no, they can't accept such child, and they will tell you they are practicing inclusion. What is inclusion if you cannot accept a child with special need and make effort to be able to teach this child to be able to learn? Because no child, we don't have right to give up on any child. Every child is unique in their own way, and no child cannot learn. Just give them that opportunity. Yes, so inclusion is very, very important. And when we try to include these special children in our community, in our places, they'll be able to be free, and the parents will be able to bring their child out, because they will know that okay, they are not going to be stigmatized if they bring their child to such places, and with that they can have the help they need. Sorry.
My advice to the parent out there is that if you observe your children very well at early age, if you notice any milestone challenges or milestone delays in development, seek for advice from the professional. And if they come up with any diagnosis, don't be in denial, because early intervention is a key. That is a way to be able to manage these challenges and acquire or achieve the desired skills.